So children with cleft palate often have ear problems, especially otitis media, and hearing issues due to various anatomical and functional factors which are there because of the cleft palate. So let us see the reasons why. First of all and most importantly is the eustachian tube dysfunction. So as we all know, eustachian tube takes care of the ventilation, drainage and clearance of the middle ear, and the secretions are taken into the nasopharynx. So what happens in cleft palate is that there is eustachian tube dysfunction, which is specifically because of the abnormal insertion of the levator velar palatini and the tensor velar palatini. So what this abnormal insertion does is there is ineffective opening of the eustachian tube. When the eustachian tube doesn't open or does not function correctly, fluid accumulates in the middle ear and causes otitis media with effusion. Now this recurrent accumulation of the fluid leads to infection. It basically causes, it is a good media for bacterial contamination or bacterial proliferation. So there are acute otitis media and acute on chronic otitis media as well. Even if this fluid is not infected, the fluid can cause hearing loss just by the dampening of the vibrations of the eardrum, and obviously the ossicles, which are also necessary for sound conduction. So these are the reasons why it is particularly common in children with cleft palate, the different types of ear problems: hearing loss, conductive hearing loss, chronic otitis media, acute on chronic otitis media. So all these things are very common, and this hearing loss can specifically impact the speech and language development of these cleft palate patients as well. So because of this high incidence of middle ear effusions and infections, many of these cleft babies require placements of the grommets. So these grommets help reduce the frequency of infection and improve the hearing. They prevent accumulation of the fluid as well.